please tell us about some of the things you've been doing at the clinic.
The clinical centre was set up to provide better access to young people to mental health services, and I know you're aware, and many people are aware in the community, mental health problems are the major problems that affect young people in the community. Young people are quite good at getting help for asthma or other kind of chronic illnesses that affect them. GPs are quite good at providing treatment for that. People understand the need for going and seeking medical treatment and taking medications or making the lifestyle changes that they need, but not nearly so aware of the issues around mental illness, not nearly so aware of how mental illness presents in young people, how it affects their lives, and the most important thing about where to seek help.
Where do they go? Where can they go?
Well, in the existing services that we've had, that's a very difficult question. The services that we traditionally have in medicine are really set up to deal with hospital-based problems. So we're very good at treating childhood leukemia, for instance, but we're not really good at treating the common problems that affect people in the community. So there's a lack of really community understanding of where to go. And then there's also been a lack of services. So there's a combination of problems. So in order to educate people about mental health and about seeking help, we've actually got to then provide systems and places that are easily identifiable and easily accessible that people can go to, get help readily, and get good quality help that they see as being kind of beneficial to their lives.
So what are the sort of mental health problems that the young people are coming to you with?
A variety of problems, and partly it depends on the age. So we see young children or younger people with anxiety disorders. As young people go through adolescence, we see the emergence of depressive disorders. We also see early substance abuse disorders. We see eating disorders emerge. And then in later adolescence, we see the emergence of more severe mental health disorders such as bipolar disorder or psychosis or schizophrenia. So we can really, if you look at the continuum across time, we could really take people from very early stages of illness, if we're able to identify it properly, and potentially stop the transition into these more serious disorders in late adolescence. So there are many things that we could do around education, prevention, early intervention that would really make a huge difference on the impact of these disorders on adult life.
Mental Health at Work is doing a lot of work in the workplaces around Australia, educating workplaces around mental health issues and how to stay well and how they can take responsibility for one's own health and well-being. We're getting a lot of parents coming to us, or
yes.
people with their parents hat on,
yep.
saying our child is not coping with life. What do we do? Where do we go to? How can workplaces actually help parents and help youth, because they're the next generation coming forward, in actually being able to help them be mentally healthy?
I think that's such a good question, because out of school, people stop having the general life education often. We get education through the media, but it's very mixed, and what you see becomes filtered by the types of sources of information that you go to. So there aren't very good opportunities to people to have ongoing education about their health and particularly about their mental health. So the workplace is a really good example of that. So people spend a large proportion of their time in the workplace. So actually helping parents understand about the illnesses that they suffer and the illnesses that their children are likely to suffer, how to identify them, how to assist people in getting help, what are the good sources of help, what are good sources of information online or out in the community, and then being able to provide support for people in a supportive environment is really important. So the workplace is a really good example of that. The other example is schools. If a parent is having a problem with a young child or an adolescent, they go to the school to seek help, and often the schools are not very well equipped to actually deal with those problems, in the same way workplaces are not well equipped to deal with those problems. So we need to equip employees and organisations with better material, better education, better understanding, better resources, so that can assist the people in their workforce to manage their own health, but also their family's health. And that's obviously associated with productivity, but also better social cohesion, better community kind of participation.
Thank you very much for your time.